Good morning and welcome. My name is Dr. Lori Werth and I am the Provost at University of Pikeville. The ability to build and maintain relationships within a community has always been a key element associated with success. Community and businesses cannot succeed without fostering healthy relationships, producing innovative products, and opportunities for collaboration. We need each other. Over 125 years ago, a college was carved in the mountains of eastern Kentucky. We are now a comprehensive university as part of an undergraduate program that's growing, a medical school and optometry college. This past fall, we welcomed a new freshman on our campus. He arrived as a business major here at UPIKE and on the football team. In August, when he was training, he was excited to be able to play his first year here as a freshman on the football team. Your typical offensive lineman, 315 pounds and 6'3", he was ready to play this year. When he came on the field in that game, he unfortunately got injured. One of the injuries that happened to him stunned everybody on that day. We had first responders that came on the field, the paramedics who arrived to support him, and the audience was stunned. As we looked at the program and saw who he was one of our students from Florida. So immediately, those of us in the audience who looked around, I was there with my husband, the president was there, and the first lady. We looked and we were praying to make sure that he would be okay. The ambulance left. The first lady and I had ended up going together to Pikeville Medical Center to see how he was doing. We entered the emergency room to be greeted by physicians and nurses who were supporting the care of community members here, and our student as well. As we entered, we met several nurses who were taking care of Trevette. They were also nurses who graduated from University of Pikeville, and we were so very proud to encounter that connection. We entered and we talked to Trevette. As you could imagine, he was scared. There was no family here, but the family that surrounded him that day with doctors and nurses and college friends that he had, and a couple of ladies who had children of our own and wanted to ensure that he was well supported. At the end of the day, after recovery and after surgery, he will now play this year. So this fall, when you come to one of our football games, look for number 62, and he'll be on the field. But that's what partnerships are. Partnerships are the spirit of collaboration that impacts the lives of people in communities. The memorandum today between Pikeville Medical Center and the University of Pikeville focuses on close relationships that are lasting and positive and that will impact this local community and Eastern Kentucky. Thank you to community members who are here today. Thank you for your support in being here and understanding how important collaboration and relationships are. I would like to introduce Randy Johnson, Chaplain at Pikeville Medical Center, who will deliver our invocation this morning. Randy.
Let's pray. Caring and wise God, we present in this event and relationship for the benefit of many and the glory to you. The sage shares with all who will listen, and he says, as iron sharpens iron, a friend sharpens a friend. You Pike and Pikeville Medical Center are friends, have come together to help one another, and with your help, bring manifold blessings to both institutions of learning and healing. May their cups overflow and so bless not only these hallowed institutions, but our city, our county, region, and beyond. May such acts of cooperation inspire other regional institutions to do the same and so multiply positively all who could be impacted by this event today. We seek your continual guidance and power, offering presence. May the whole of this action be much more than the sum of its parts. As iron sharpens iron, a friend sharpens a friend. Glory be to God.
Thank you, Randy. President Burton Webb and Donovan Blackburn have worked closely together and have forged a friendship. Dr. Webb arrived at University of Pikeville in January of 2016 as the 21st president of our university. His extensive background in higher education spans over 25 years and also includes experience teaching within a medical university. It's important to know that the two individuals who we will be talking to today and hearing from, collaboration and partnerships occurred from day one. As Donovan reached out as well, in his unique position at that time as city manager, he was interested and keenly interested in higher education issues and many healthcare initiatives. Right now, he has a position that very much is attuned to ensuring that there's community partnerships and collaborations within our healthcare community. He now serves as the Chief Executive Officer at Pikeville Medical Center. Please welcome Dr. Burton Webb, who will be followed by opening remarks from Donovan Blackburn.
So we're actually going to mix this up a little bit and both talk at the same time. So, Donovan.
That's scary.
I know, it is just a little bit scary, but we thought as we just talked a few minutes ago, we planned everything about this except for this moment where we would both talk. So this was the one thing that we didn't say. Donovan, I think you and I met almost 3 years ago because you were on the search committee when I was hired here.
I was. As a matter of fact, when I just listened to Randy's prayer, it kind of hit home on a couple different levels, because when you talk about the friendship was formed actually before you even came to work here.
Right.
So it was a huge opportunity for me to get to know the next president of the university, but also was a great blessing and a wonderful start of a wonderful friendship.
Yeah, it was. And I remember the first time we got together, I think it was right around my birthday, February 3rd or 4th, and that would have been 2.5 years ago now. And we were sitting in your office, in the Pikeville City Manager's office, and we had things, that the college and the university, or the university and the city needed to partner on, and we were talking about the football complex and, soccer complex and everything else. The Expo Center, I think, was a big topic that day. But then all the business stopped, and we both got coffee or water or something and just kind of leaned back, and for the next, what was supposed to be a 30-minute meeting turned into 90, I think. And we just sat back and said, what if? What would happen if the university and the city could partner together in just tremendous ways? And then we began to dream broader than that. We said, what if the university and local businesses could partner together? What kind of transformative change could an institution like the hospital make if the hospital and the university got together on the same page and began moving forward? And those conversations were really exciting. Do you remember that?
I absolutely remember that, and here we are today.
Yeah. Yeah, how about that? We had no idea, did we?
We did not. Excuse me. One of the benefits of working for a hospital is you get the opportunity of every germ coming and going.
That's right. Yeah, I did that for a long time. I understand, yeah.
You get to bring that home with you, which is part of the throat problem today of all days. But no, again, I go back to not only the friendship that was forged, but the discussions that were had in the early days, and then the excitement that once this announcement was made and the opportunity of our ideas, your board's ideas, my board's ideas, coming together. When you look at the history of our two entities, we're giants among the field, and we have a tremendous, not only commitment, as we discussed during that time, to patient care with what the university was doing towards the medical center, or the medical school, and then the partnerships that we had with the hospital, but also the economic opportunities that would lie ahead that by our two agencies or entities really coming together with some type of cooperative initiative. At that time is with the city, and a lot of initiatives went forth over the previous 2 years and when we served in position. But this is a huge step, I believe, for us, for the region, and for economic opportunity. It's outside just patient care. Patient care is what we do.
Right.
Education is what you do, but it's far more vast than that.
And for me, I think one of the most unique intersections that you and I spent quite a bit of time talking about was the whole concept of wellness. Because right now, the way the hospital is oriented is patient care. It's very procedure oriented, and there is a strong wellness component to it, But what the university brings to that is this wealth of educational background so that we can help to really expand that idea of wellness into the community in the ways in which we partner together. So some of the bullet items that are in that memorandum are really intentional ways that we hope to build on the idea of care and preventative medicine and wellness so that we can move the whole community forward in that direction.
Absolutely, and when you look at the past of the relationships that we already have in place, some, obviously, that's gone on for some time since the medical school, the nursing program, but there's been a lot of new initiatives too over the last several months that fosters what that mission that you and I had that we spoke about 2 years ago. You know, one of the things from our perspective that we've been very appreciative towards the university is recently, you know, we have an issue in trying to supply nursing staff to our
Right.
hospital.
Right.
And, you know, last year we turned over 170 nurses that came through the region. And it's because we have such a demand that we have to go outside the area at times in order to be able to bring people in. Burton was so gracious during one meeting to voicing a concern about our nursing program. And this recently they announced that they expanded our nursing program to 60.
To 60,
Which
yeah.
is huge for the hospital. It's huge for this area from an economic opportunity standpoint because it's allowing people to stay home, getting good jobs and working. And it has a lot of play into also the economic opportunities because these are people that are staying here investing in the community. A more recent partnership that we had was the signing of a research program.
Yeah.
To where there was actually a contract signed to where we're supplying by patient's authorization skin samples that you are now taking, the university's now taking and doing research with. So those are just some of the opportunities. Speaking of the nursing program too, and I'm very grateful to the university, but also a great opportunity for the hospital. I see my chief nursing officers sitting in the audience, but you know, we have a new program that we were able to launch allowing the nursing students to actually come into the hospital and work and actually get paid to do so. So
Right.
it fosters a relationship with the nurse, but it also allows us the opportunity of really molding somebody that is going to be a future full-time employee for us. So I mean, it's just wonderful opportunities, great health initiatives. And again, these are things that have just taken place in the last 3 months.
Yeah.
Imagine once we sign this document,
Yeah.
really what's going to happen.
Well, and that's the really key thing, because what maybe a lot of folks in the audience don't realize is that in order for the university and the hospital to apply for federal grant money, we need to have formalized relationships.
Amen.
And that's really what this is about today, is formalizing that relationship so that we can go to the National Science Foundation, the National Institutes of Health, and other places, and apply for some of the large grants that will really help to grow the development of healthcare here in this region. So this is for me, an open door. And I think it's something that can move forward in great ways.
Well, you know, and the importance of this is this, and anybody that's in this profession, you know, obviously I'm a year into healthcare, and so in a year's time I've learned quite a bit. But when you look at the acuity level of our region, and you look at issues such as respiratory problems, heart conditions, cancer, those are issues that I won't say we're plagued with, but we're higher than the national average. It all plays to both health and it also plays to economic development. I keep tying those two things together because without a healthy workforce, you can have a diverse workforce, you can have a trained workforce, but if you don't have a healthy workforce,
Yes.
then it's hard to recruit people to your region or to your industry. So to create industry and to foster that growth that's needed. So it's these initiatives that when you look at these two giants, and I call them giants because these institutions came along way before we did.
They did.
But it's because of the friendship and the partnership and because of what both of our boards want to see happen for our region. This relationship being forged together is going to do so much more. It will lend the opportunity for grants and for federal funding, but also what it's going to do is foster ways that we can grow. You know, there's things that we're not talking about today that this contract or this agreement will allow us to step into by bringing both, you know, one of the things that I really liked, and I commend Burton because he's the one that actually wrote the memorandum and put a lot of thought into it. But one of the things that I really am looking forward to is bringing our executive staffs together.
Yeah, absolutely.
Because I'll tell you, I don't have the ideas. I see several of my executive staff members and board members in the audience, but I mean, they're a wealth of knowledge, and being able to take that knowledge and to utilize the skills and the resources and the knowledge that the university has, being such a powerful source in this region is really going to take us places. I'm really excited about the opportunity, certainly appreciate the willingness and the cooperation and the vision to allow this region to move forward using both entities and coming together and using the resources that we both have.
You know, you get 6 creative people in a room, and I think you get a good set of ideas, but when you get 12, and from the diverse backgrounds that we're going to have coming together on at least a quarterly basis,
Amen.
to create new ideas and new innovative pathways for this, this community, I think it's going to be a wonderful thing. So thanks, Donovan. Appreciate it.
Pleasure's mine.
You have anything else to say?
I think I've said enough.
Okay, I think I have too. So we're going to sit down and ask Dr. Ruth Lavigne to come up.
I'd like to introduce Dr. Lavigne. She is a radiation oncologist at Pikeville Medical Center. She earned her medical degree from University of Cincinnati and is board certified by the American Board of Radiology. She and her husband, Brad Collette, moved their thriving practice from northern Kentucky all the way to Pikeville, where they believed that they could do the most with their skills and treatment abilities. And if you ask their patients, that's exactly what she has done. She's done the most good. It's no surprise that she is a 9-time recipient of the Best Doctors in America Award. Would you please help me welcome Dr. Ruth Lavigne.
How do I try to follow Burton and Donovan? That's kind of rough, but we have a great gathering here today. Community leaders, UPIKE professors, and PMC senior leadership and organizational members all brought together for a singular cause, the Memorandum of Cooperation between PMC and UPIKE and the celebration of it. So on behalf of my colleagues at PMC, thank you so much to everybody for coming. Simply put, collaboration means co-laboring or working together, and that's what we are strongly committed to. Working together to improve the community we serve. So the goal of this collaboration is to help build momentum for a healthier and more economically stable region. As a leading provider of healthcare in Eastern Kentucky, this is certainly in keeping with our commitment and vision as a medical center through outreach programs, free health fair events and screenings, and by being one of the region's largest employers, much like UPIKE. It's clear that healthcare and education go hand in hand in improving the social environment and expanding community resources. And I have had some wonderful experiences with collaboration with the university that I just want to share very briefly. As the Quality Improvement Coordinator of our cancer program, it's my job to identify areas of potential opportunities for improvement in the program and in the community that we serve. This calls for research not easily accomplished by a busy clinician. I have several students that rotate through me from the university in the radiation oncology department, and I reached out to some of them and have set up several studies and ongoing projects with medical students and undergrads as well. Their help is invaluable, and they get to learn about both research and reaching out and getting involved in the community around them as well. So everybody benefits. And currently, just some of the work that we're doing right now, we're working on studying impediments to colon cancer screening and what attitudes drive those numbers, or that lack of number that we're looking for. We're also working on a collaboration that is going to help us to provide a iPad in the family practice clinic that is very, very easy to use for patients to go through and fill out an application process so that by the time they even get to their primary care physician, their need for colon cancer screening and what type of screening should already be very clear. When they present their iPad to the doctor, that doctor should be able to know exactly what type of screening and when to recommend it, which is, it's a lot more effective than the doctor saying, you know what, you're 58 and you've never had a colonoscopy, it's time. But to show, here's why you need it, this is the risk category that you fit in, and let's go. So it has been such a wonderful experience, and one of the medical students came to me the other day and she said, I just want to tell you where I am with this research. It's so exciting. She said, thank you so much for giving me this opportunity. I feel like I've grown so much and I've learned so much. And I was looking at her thinking, well, we wouldn't be anywhere without you. So it's just a great, example of how collaboration works. So starting today, and not that we haven't been doing this for some time, but we look at our community together and take note of the health and wellness issues faced by its citizens. We work together to find solutions and to find ways to attract stable business to the area. And today we begin to have a positive impact on the people of Eastern Kentucky together. By building these relationships based on trust and mutual respect, we can come together around these goals and decide how best to attain them. That's when people work together and when we collaborate well and guided by a worthy purpose, everything's possible. So that's our hope. Thank you.
Thank you, Ruth, very much. We have the privilege of welcoming Senator Ray Jones. He has represented District 31 in Kentucky since 2001. Currently, he serves as Senate Democratic leader. Graduating from Virgie High School, now Shelby Valley High School, he earned a BA from Eastern Kentucky University and earned his JD from University of Louisville. He resides in Pike County, owns a vibrant law practice in the city of Coal Run. We're so honored to have you as part of this milestone agreement. Ray, thank you.
Well, this is certainly a big day for our community, and it's something that I think is long overdue. We have had in the past discussions about trying to build a medical research facility in Pike. Several years ago, we had some meetings, and that was discussed. And I think with Donovan's leadership and Dr. Webb's leadership, that may be something that we can see happen down the road. I think Dr. Lavigne basically touched on something that is probably has the greatest potential for our community. Is no other community this size that I'm aware of anywhere in the country has a university that has been this progressive with a medical school and an optometry school. And the potential for collaboration with the leading healthcare facility in Eastern Kentucky is tremendous. We have a lot of issues that need to be addressed, whether it's, as was discussed, colon cancer research. We have very high rates of lung cancer, cardiovascular disease, diabetes, and as you know, the opioid epidemic has been a tremendous issue, and hopefully this collaborative agreement will help address those issues. Our community's also weathered a significant storm with the loss of coal jobs. And we are poised to see new companies like Interblue, App Harvest, Silverliner come to our community. Those would not be possible but for the institutions like the University of Pikeville and Pikeville Medical Center. Those are two institutions that set Pikeville and Pike County apart from all of Eastern Kentucky and all of Central Appalachia. And this collaborative agreement will help foster more economic development. And if you look around the coal fields, we have prospered when others have really struggled. And things haven't been easy here. One thing I would like to see is at some point in the near future, I would like to see this collaborative agreement expanded to bring in local government, municipal government, and state government. Because these issues affect not only Pikeville and Pike County, but this entire region. But this is a great day. And I think in the years to come, we're going to see tremendous growth potential here in this region, in particular in Pike County. It's a pleasure to be here today. Congratulations to the administration and staff of the University of Pikeville and also Pikeville Medical Center on a job well done. Thank you all for what you do for our community and all of Eastern Kentucky, and I look forward to working with all of you to make sure that we can move Eastern Kentucky forward so it can reach its full potential. Thank you.
Thank you, Senator Jones. We appreciate your support. We have the privilege of also welcoming our city manager, Philip Elswick. We appreciate his partnership within this community, and it is essential as we live and we have opportunities to interact with our local businesses. While serving as deputy city manager, he oversaw code enforcement, engineering, and many of the city's projects. Mr. Elswick is very involved in city economic efforts, which includes the Fiber to the Premise project and development of the Kentucky Enterprise Industrial Park. Prior to this position, Philip was the president and CEO of a regional engineering consulting business that was based here in Pikeville. Please help me welcome our city manager, Philip Elswick.
Mayor Carter was unable to be here this morning, and he extends his regrets. On behalf of the city of Pikeville, we're excited about these initiatives that have been announced, and to see our large institutions such as Pikeville Medical Center and UPIKE continue to work together to improve health care and education for Pikeville and the surrounding region. The city is always willing to partner with any institution or organization to improve the quality of life of our community. We've partnered on a number of things with PMC and UPIKE, and by addressing both education and healthcare needs, they've been tremendously successful and led to the diversification of our economy and many other benefits for our community. In reality, the things that we've done at the industrial park, the announcements we've made, UPIKE and PMC have played an integral role in those announcements. As others have said, that there's not too many places in this country you can find a city like Pikeville that has a large medical center and a large university of this, a city of this size. As Pikeville moves forward, and we are looking forward to future partnerships with PMC and UPIKE to continue growth trajectories for both the city and these institutions. Working together toward common goals and initiatives is at the core of Pikeville's progress over the past many years. We're proud and honored to be a part of today's events and fully intend on continuing our progress working hand in hand with PMC and UPIKE to ensure the future of Pikeville and our region continues to be a very bright one. Thank you.
We will now move to the signing of a memorandum in the program. Thank you. And as we conclude, Rob Musick, our campus chaplain, will be delivering our benediction. Afterwards, please feel free to stay. There'll be opportunities for the media to ask questions. The president and Donovan will be available, but we thank you so much for being here. Rob?
I imagine today Reverend Blythe with tears in his eyes, just can't even imagine what's going on today. May I leave you with this blessing. Now may the Lord, who is a divine partnership of Father, Son, and Spirit, inspire you to dream bigger, work harder, and reach out further. Today may you be challenged to work unity and cooperation between our city and county, at the 4th of July family gathering, on Facebook, in your work department, and even with that super political friend. May your life be changed by the care of the hospital and the ideas of the university, the new things which will be birthed today. Now may the single mom who is balancing a couple kids, a mother with declining health, and a father who is now seeking a new way in recovery, may this day provide her a tangible way for her life to be empowered. Please now go with the words of Scripture that say, nothing is impossible with God. Go move mountains with our cooperation. Go in peace.